Breakdowns in public health infrastructure, that is what a leading research scientist says has fueled the Ebola epidemic.
Well, for weeks, public health officials calmed fears, saying plans were in place to prevent the transmission of the virus within the U.S. But now a health worker in Dallas has contracted the disease. News 3 reporter Delozier spoke today with an expert in emerging infectious disease about the epidemic.
Yeah, Eric and Michelle, Tony Goldberg has spent more than 2 decades studying infectious diseases in Africa, including doing field work there. He says Ebola has been on the radar for a long time and much is known about it. The problem from his perspective is that the ball was dropped in recent years in doing enough to stop the virus.
Clearly, we don't know enough because of what's happening in West Africa and in the United States.
The search for answers, just like Ebola itself, has gone on for years.
Clearly, what we know has not been adequate to stop the epidemic.
Tony Goldberg believes in part that is because of what we did stop.
People's lives are at stake, and we have, in the case of Ebola, candidate vaccines that would be effective if they were approved. The cuts in research funding we've seen in recent years have halted the progress of the research on those vaccines.
Goldberg has studied emerging infectious disease in Africa for more than 2 decades, including fieldwork there. He says even though much is known about Ebola, not enough was done to stop the spread.
The reason why we have an epidemic is not really because of lack of vaccines or treatments, although that would surely help. The reason we have an epidemic is because of breakdowns in public health infrastructure.
Goldberg says the next few weeks will be critical to stopping the spread of Ebola in the United States. While resources are now being targeted to do just that, the real question is what we learn from all of this.
We are in crisis mode. So we're doing a lot to stomp out this fire. But that's not really the acid test. The test is going to be what follow-up is there. Are we going to make the investments in research and public health infrastructure that we should have made decades ago so that this would never have happened? If we simply put out this fire and move on to the next fire, we're going to have Ebola again.
Now, with regard to discussions about shutting off air travel to countries in West Africa with Ebola cases, Goldberg questions whether that would work. He says that it could actually fuel the spread of the disease as people flee to cross borders on the ground. And Eric and Michelle, he also points out that that would limit healthcare workers' access to the region, and they're just trying to stop the disease.
Well, he seems really well versed in his experience in Ebola.
Yeah, he is a leading researcher out there, absolutely.
All right, thank you, Dave.
Thanks, Dave.